Imagine a disease that can silently travel through the air, infecting people who have never even touched an animal. A disease that starts with flu-like symptoms but, if left untreated, can lead to life-threatening complications. This isn't the plot of a medical thriller. It's Q fever, a rare yet potentially serious infection that everyone should know about. Welcome to MediByte's deep dive into Q fever, what it is, how to recognize it, and most importantly, how to protect yourself and your loved ones. Q fever is an infectious disease caused by the bacterium Coxiella burnetii. What makes this bacterium particularly concerning is its ability to survive in harsh environmental conditions and its preference for living inside the body's own cells. While Q fever is related to the group of illnesses known as rickettsial diseases, it stands out for several reasons. Most notably, its capacity to spread through airborne particles and its association with livestock such as sheep, cattle, and goats. Let's break down what you need to know about Q fever, starting with its symptoms, moving through diagnosis and treatment, and ending with crucial tips for prevention. Symptoms of Q fever. The first challenge with Q fever is that its symptoms can range from almost non-existent to extremely severe. About 9 to 28 days after exposure to the bacteria, symptoms may begin suddenly. For some, the infection is so mild it goes unnoticed. For others, however, the onset can be dramatic, resembling a severe bout of the flu. Typical symptoms include a high fever, severe headache, chills, extreme fatigue, muscle aches, loss of appetite, and intense sweating. One of the distinguishing features is the absence of a rash, which helps set Q fever apart from some other rickettsial infections. The lungs are frequently affected, leading to a dry, unproductive cough, chest pain, and shortness of breath. Signs of pneumonia developing as a complication. Sometimes the infection spreads to the liver, causing pain in the upper right part of the abdomen and even jaundice, a yellowing of the skin and eyes. For pregnant women, Q fever is particularly dangerous, increasing the risk of miscarriage or premature birth. Even after the acute infection passes, up to 20% of people may experience post-Q fever fatigue syndrome. This lingering condition brings severe tiredness, muscle pain, headaches, sensitivity to light, mood changes, and insomnia. In rare cases, less than 5%, the infection becomes chronic. Chronic Q fever can develop weeks, months, or even years after the initial exposure, and often targets people with weakened immune systems, pre-existing heart valve problems, or pregnant women. The most serious complication is Q fever endocarditis, a potentially fatal infection of the heart's lining and valves. Diagnosis of Q fever. Because Q fever symptoms so closely resemble those of other illnesses, diagnosis can be challenging. Doctors often rely on a detailed history, asking about recent contact with livestock, visits to farms, or living downwind of animal facilities. This is crucial because Coxiella burnetii is primarily shed in the milk, urine, and feces of infected sheep, cattle, and goats, and can become airborne, spreading over long distances. Laboratory tests are essential for confirming the diagnosis. The primary tool is an immunofluorescence assay to detect antibodies against the bacterium in the patient's blood. However, a single test is not enough. Doctors need to repeat the test 3 to 6 weeks later to check for a significant increase in antibody levels. This means that a definitive diagnosis may not be possible in the earliest stages of illness. For faster results, molecular tests such as the polymerase chain reaction, PCR, can directly detect bacterial DNA in blood or tissue samples. In some cases, a biopsy of infected tissue may be necessary, especially if chronic Q fever is suspected. If pneumonia is present, a chest X-ray can help assess lung involvement. Treatment of Q fever. Treatment of Q fever centers on antibiotics, with doxycycline being the medication of choice. Most people respond well to a course of antibiotics lasting about 2 weeks, and symptoms typically improve quickly after starting treatment. However, for those who develop chronic Q fever, especially with heart involvement such as endocarditis, treatment becomes much more complicated. These cases require a combination of antibiotics for several months or even years, and careful medical supervision is essential to prevent relapse and manage complications. Without appropriate treatment, acute Q fever can be dangerous, particularly in older adults or people with weakened immune systems. The mortality rate for untreated Q fever is low, about 1%, but chronic Q fever endocarditis is almost always fatal if not properly managed. With modern antibiotics, the survival rate for chronic cases has improved significantly, but early recognition and prompt intervention remain critical. Prevention of Q fever. Given its potential severity, preventing Q fever is vital, especially for people at higher risk. This includes veterinarians, meat processing plant workers, slaughterhouse and dairy employees, livestock farmers, laboratory researchers working with animals, and anyone living near farms with sheep, goats, or cattle. The bacteria responsible for Q fever can survive for months in dust and dried animal waste, and it only takes a single organism to cause infection. Therefore, avoiding exposure is key. Here are some practical prevention strategies. Avoid consuming unpasteurized milk and dairy products, as these can harbor the bacteria. Use protective gear, such as masks and gloves, when working around livestock or handling animal birth products, manure, or bedding. Ensure proper ventilation and hygiene in animal facilities to reduce airborne spread. Regularly clean and disinfect areas where livestock are housed. Pregnant women and individuals with compromised immune systems should take extra precautions and avoid direct contact with livestock, especially during birthing seasons. In regions where Q fever is common, some countries have implemented vaccination programs for at-risk populations. However, vaccines are not universally available, so awareness and preventive practices remain the frontline defense. Q fever is also considered a potential biological weapon due to its infectiousness and environmental resilience. This underscores the importance of surveillance, rapid detection, and education to prevent outbreaks and protect public health. As we've seen, Q fever is more than just a rare infection. It's a complex disease that requires awareness, vigilance, and prompt action. By understanding the symptoms, recognizing risk factors, and taking preventive measures, we can reduce the risk of transmission and ensure better outcomes for those affected. If you found this information helpful, please like this video, share it with your friends and family, and subscribe to the MediByte channel. Don't forget to turn on the notification bell so you never miss out on our latest health insights and medical updates. Stay informed, stay healthy, and thank you for watching.